Hello, I'm Dr. Fiona. I just got my second dose of COVID vaccination 3 days ago, and I'd like to share with you my experience. This time, the injection process was much faster. I got there, got my documents verified, and went straight for the injection. There was no lecture session and no consent signing. Well, I guess the first consent probably covered for both injections. The vaccine felt a bit cold when it was going in, however, there was no pain. So quite a smooth process, no bruising otherwise. When they inject, it doesn't matter whether they inject in the right or the left side, but because most people will get the sore arm, and sometimes, believe me, it can be really sore, where I really couldn't lift this arm for at least one night or two. So it would be good to inject in the non-dominant arm, which means if you're right-handed, you will ask them to inject on the left side. If you're left-handed, you will ask them to inject on the right side. So that if you get the sore arm, you will still be able to do most of your daily duties. As for myself, when the sore arm was really painful, I couldn't lift it above my head level. So if you want to take off your clothes, it becomes difficult. Also, when I tried to push the door handle down, this became painful, so I couldn't use my left hand to open the doors. I had to depend more on my right hand. So best to ask them to inject on your non-dominant hand. Well, if you really get the sore arm, don't panic. There's a little trick I learned just to get some movement in the arm. What you do is this. Actually, just say if your arm cannot raise beyond this level, what you do is you take your other hand and you start to slowly, passively push your arm up beyond the level where it's painful. It will feel a bit painful, but just keep on slowly pushing it up until it reaches beyond, until it passes beyond the pain level. Once you do that, you'll feel as if the muscles sort of relax for a little while. Then you can slowly put down your hand and you'll be able to lift your hand for a short while. However, this relief will last probably about a few minutes before it comes back again. Then you probably will have to repeat the same process. Now let's have a look at the injection site. It's been about 3 days after injection. When they injected the site, there was no pain, no bruising. Well, let's have a look at it again, okay? Now everyone gets to see my deltoid again. Anyway, here's the injection site. As you can see, no problem with it, no bruising. So they did a pretty good job with it. Sometimes you may get some bruising. However, it's because when we inject, it's a blind process and sometimes it may actually shear or tear through a vessel. That's why they get bleeding. However, even if you get the bleeding or swelling there, it may look dramatic, but don't worry, it will go away within a few days. Now, let's talk about the more interesting side effects. Well, sore arm is just sore arm. After that, it goes away, nothing much. Well, what happens is this, after they injected, I was quite okay. Then I started feeling hungry. Of note, they injected me at about 9 o'clock in the morning. Then about 10:30, I feel like ravenously hungry. So I actually ate like a whole meal. Then later at about 2:30, I was feeling hungry again. So I ate another meal. And then tea time was hungry again. So I ate like quite a lot of biscuits. And then at dinner time, I was like eating like my normal. However, I felt this hunger out of proportion because normally maximum I eat is 3 meals a day. I was on like some kind of hunger rush or something. The second day was about the same. I found myself nearly eating like 5 meals a day. But the good thing is, after the second day, I got a bout of diarrhea and it just, well, I guess it sort of balanced the calories. Then my bowel and appetite was okay again. I also did get some fever. However, it wasn't on the first day. The fever actually started on the second day. I was quite normal. I was doing some surgery, seeing patients as usual. Then towards the evening, I started feeling as if my body was a bit hot. Even though I drank like normal temperatured water, I feel it cold. When I showered, I switched on the hottest temperature and still I felt cold. Then I went under a few blankets and I really was having chills. However, when I tested my temperature, it was only about 37.2 degrees, like low fever. And after a while, I started getting this funny headache. It's like someone using a rubber band trying to, like hit like this part of your back of your head like that. So after probably about in the night, I decided, okay, enough was enough. So I just took 2 Panadols and in the morning, I was fine again. Not too bad. After hearing my symptoms, you probably think, oh no, she got side effects, better not take the vaccine. However, you have to understand, maybe about half the people who take the vaccine will experience symptoms like this. Well, I wouldn't really call these side effects. However, I feel that these are signs that the vaccine is actually working. Now, if you experience these symptoms after the vaccination, it means two things. Number one, they give you a true vaccine, which was kept properly. That's why your body is mounting a correct immune response. And number two, your immune system is actually functioning. It's sort of like a house alarm. Basically, when you put on the house alarm, you want a trial run. So the second vaccination is like the trial run to charge it up, and you just press the alarm to see if it rings. If it rings, that means if your body has symptoms, it means your immune system is functioning. That means the alarm is functional. Also, don't be super worried if you have absolutely no reaction, because studies have shown that basically different people react differently, and people who are older sometimes get milder symptoms compared to younger people, because it depends on the immune response. Like younger people, they probably have huge amount of antibodies circulating around, hence they launch a massive response. Well, in older people, the response is a bit slower and maybe a bit fewer, but whatever it is, the vaccine is still effective. Now, here's how you should prepare for the second dose of COVID vaccine. Number one, get ready all your personal documents, wear appropriate clothing, and be on time. Number two, the symptoms should start within 3 to 5 days of vaccination, so it may be a good idea to inform your boss that you will be maybe taking leave a day after or a few days after the vaccination in case you're symptomatic. Rest is very important because after vaccination, your body is busy fighting a mini flu. So it has no time to do anything else. So if you rest properly and take plenty of fluids, for myself, I basically took at least 3 or 4 cups of honey lemon, which helped a lot with the symptoms. Also, if you feel feverish, you can take Panadol. Now, after vaccination, they give you a digital certificate, something like this. Basically, it states your name, your identification number, and the batch and dose and expiry date of your vaccine. Now, you may think that this certificate is of little use and maybe just for fun, we will just post it on social media. Let everyone know I've been vaccinated. This actually has a very different purpose. So, vaccination is just the first step to opening up our borders and getting back our previously normal life with no mask, no social distancing. So there will be a time in the future where you will require a vaccination certificate for you to travel, go to certain events, or maybe to attain certain positions. It will also make a difference to decide whether or not you need quarantine after a COVID-19 virus exposure. Because what happens is we're aiming for herd immunity. That means if enough people are vaccinated, this will protect those who are not eligible for vaccination. So, message of the day. Get registered, get vaccinated. Protect yourself, protect everyone. Thank you.